Hey guys, Dr. Tim Uselton here with Trinity Integrated Medical, and the subject matter for today is peripheral neuropathy and the treatment of this condition. It's a very difficult condition to treat. Most of the Western medical world does not know how to treat it. They usually prescribe gabapentin and hope for the best, which is a tough drug to get off of, and it may or may not give you a decrease in symptoms, but I know one thing it definitely doesn't do, and that is rebuild any nerves. So our treatment approach here is a little bit different. We have discovered through our board certification course a treatment called combined electrochemical therapy. CET, combined electrochemical therapy. So it's real simple when you think about it. We're basically combining the chemicals that your body needs to rebuild these nerves, which are primarily B vitamins. We put a mixture of B1, B6, and B12 into some lidocaine, into some sodium bicarbonate, and we mix it up. And then we inject that solution in and around the nerves of your feet, okay? That's the chemical part. And now it was called combined electrochemical. The electro part, we have this machine that uses vasopneumatic pumps with electrodes inside them. And we stick these suction cups on and around your feet and your ankles all the way up to your knees. And after we inject you with that B vitamin, it's got a little lidocaine with that B vitamin, so that when we put you on the electrical part, it draws and pulls those B vitamins all across all those little small density nerve fibers that are shown as damaged on your punch biopsy test. So let me make this clear. We use electricity to pull the nutrition of B vitamins across the nerves that helps them heal. So combined electrochemical therapy has been FDA approved for several years, but it's gained more and more popularity as time has gone off. We got our first couple of these very expensive machines here in the office about a year and a half ago, and we bought one, and then within 2 months it was completely full from the time we opened in the morning till the time that we closed in the evening. So we bought a second one. So now we have the opportunity to treat 2 people at the same time, because this treatment takes about 30 minutes. It starts with the B vitamin injections, and then it goes on to this other combined electrochemical therapy technique with our electrical machine. So it's a very effective way to rebuild the myelin sheath, that cholesterol layer, with some protein around the nerves. And we're talking, when I say nerves, we're not talking about nerves like an extension cord. We're talking about nerves that are smaller than the diameter of hair on your head. These are the smallest density nerve fibers in our body. So we've already tested them. We already know they're damaged. We know where they're damaged. And now we're going to pull those B vitamins across those nerves, and they're going to heal and replenish. And you can also supplement B vitamins. It's very important to do so. The more B vitamins you can get in your system, the better it would be. Oftentimes people will report, hey, I started taking a supplement B6 and B12 combined, and my symptoms have gone down. We also get the same report with people taking alpha lipoic acid. It is in high dosage, about 1,200 milligrams a day for the first month or so. People begin to take that, and it starts to slowly change the dynamic of the nerve pain, numbness, tingling, or that burning sensation that they have from their peripheral nerves. So those are good to add as an adjunct to what it is we do as an additional treatment, but the combined electrochemical therapy that's FDA approved is the way to go for the best outcome for peripheral neuropathy. Now, we do have some cases that walk in here that they've got lesions on the skin. They have massive amounts of diabetic peripheral neuropathy. And those are more difficult cases. I'll go ahead and tell you that some people have a lot of complicating factors when it comes to being able to tell them how good this is going to actually be helping them. It's best to treat it early. It's best to treat it often. It's best to get ahead of it before it gets worse, because the worst case scenario is that you lose the feeling to the point to where you no longer can drive a car, or you can't feel your feet underneath you, and you fall, and then you break a hip. So we don't want that to happen. It's very common that a fall is because of just a loss of balance due to not being able to feel your feet. We got patients that come in here on walkers that graduate to canes, that graduate to no cane whatsoever within a very short amount of time, maybe 3 to 4 months. This treatment that we do, the combined electrochemical therapy, one of the best news that I can give you, best bits of news, is the fact that it's covered by most insurance companies. So it's not a totally, unregulated type of treatment. It's very regulated, and we know exactly what it does and how to use it and how it works. So that's combined electrochemical therapy. If you have any questions about anything related to neuropathy or our treatments here, then by all means, reach out to us. Make comments below, and watch the rest of our videos if you'd like. We have more on this topic as well as others, and you can also find out more information on our website at trinityintegratedmedical.com. And again, I'm Dr. Tim Uselton, and I'm signing off for now. Hope you have a great day.